Hello, I'm Dr. Dennis McKenna. I'm joined today by Dr. Vic Becker. Vic, it's great to have you here today.
Good to be here, thanks.
Vic, of course, is our System Chief Health Information Officer, been with us for a few years now and has been obviously very much involved in our entire EPIC project. We're going to talk about that in a moment. I know you've sat here before as well.
I have, yep.
So we'll get an update from you. Welcome. Today is Monday, March 3rd, giving you the update from Albany Med. So we've entered March, that's great. Weather this weekend was a little bit better than it's been recently, so hopefully it'll get warmer soon. And speaking of March, we just had an important anniversary come and go here. Some of us in the room were talking about this. So it was 5 years ago when we did the first video here at Albany Med. It was Monday, March 16th, 2020. And I remember it like it was yesterday with Dr. Fred Venditti. So maybe in the near future we'll do a look back at that period. All right, so Vic, you're here today, and you're here specifically because we want to talk about EPIC, a project that you've been involved with us from the very beginning. So let's back up. In 2024, a landmark year in the Albany Med Health System, we brought EPIC on board on the Albany campus in the first half of the year, and then we called that Wave 1.
Yes.
And then we did Wave 2 in the second half of the year at Columbia, Saratoga, and Glens Falls, right? And obviously we're very proud of that. We took what is basically 14 different medical records, some paper, many different systems that didn't talk to each other, and created what we call one neural network, one singular platform across the system. First of all, thank you to you and your team. Any updates since then? Let's start with that. Wave 2, how did it go?
Yeah, sure. So Wave 2 occurred, it was early November of 2024. As with any EMR implementation, it's bumpy. It's, as you said, replacing the neural network at every hospital, every facility. But I would say Wave 2 went smoother than Wave 1. Since then we've really been focused on stabilization, on getting the Wave 2 campuses back up to speed, getting them operating as efficiently as possible.
And we'll talk about stabilization in a second. It is important to point out, though, that when we did this work, we often talk about being a health system. We don't want to be a system in name only. We truly want to operate closer together, integrate where we can integrate. I can list many areas we've done that in. What we've done with the EMR allows us to do that type of work. So you worked not only with this campus, but you work with leaders on all the campuses. One of the first things we did, ironically, once we put the system in across the new electronic medical record across the system, is we had a planned downtime, but we did it on all the campuses at the same time. There must be some advantage to doing that. What was the advantage of doing everybody at the same time? Well,
it was a regular kind of system maintenance approach for some of the hardware at EPIC that EPIC hosts. It was relatively brief, but really we're all observing the same processes now. We all benefit from EPIC's downtime tools. We still have read-only access to EPIC even when the system is down. It was the first time for the Wave 2 campuses. Wave 1, Albany Med had done this before, so it was really introducing those tools to the Wave 2 campuses for the first time.
Yeah, very good, very good. And you used the word stabilization before. Talk a little bit about the difference between what we're doing now, which is stabilizing our platforms, versus what many are looking forward to, and I know you have some ideas behind optimization over the next year or a couple of years.
Yeah.
Talk about those.
So stabilization I would characterize as really doing the work to get folks back to baseline, functioning well. It's different. It's not restoring baseline processes. It's adequately adopting the new processes to return to a baseline level of functionality using a new tool set.
Okay.
Our next phase of enhancements and optimization is really, it's realizing the intent to realize the benefits that we have sought by standardizing to a single system, and I would say the state-of-the-art system that's available on the market.
And what are some of the things that people can look forward to in an optimization world? Are there certain analytic tools or different things that will, from a end user experience, will be better for us?
Yeah, so that's an interesting point you brought up about the analytics. So one of our tasks we face first is really adopting common nomenclature or common definitions, so that when we perform our reporting and analytics, that it's meaningful across the campus. We're all speaking the same language. But in terms of the new functionality that we will be adopting over the next several months, we're looking at tools to reduce interruptive alerts, for example.
Right.
Minimize the disruptions to providers and nurses when
Right.
caring for patients, make them more meaningful.
Vic, do you want to put a plug in for the tool that we have available for us called Thrive, which is an ability for us to work with providers and think about ways in which we can make their workflow more efficient? There's some tools that Epic offers us where you can sit down with people and say, we think that you can accomplish the same thing but with less clicks or less mouse movements. Do you want to talk about that?
So the Thrive program targets providers specifically,
Right.
but our informatics team also has tool sets that are available
Right.
to help with targeting nurse training and
Great.
nurse education. The signal tools that Epic produces enables us to look into the utilization of our Epic system at a single user level. So we can make very informed decisions and identify folks who might be outliers, struggling with Epic in some areas,
Right.
and make intelligent interventions on their behalf to make them more efficient, to reduce frustration.
So if someone's out there hearing that and they'd like to reach out to you, they could just drop you an email and you could figure out how to get that work assigned.
Yeah, probably the best way to get help is calling the help desk and request Thrive training.
Thrive, Thrive, Thrive
Yes.
training. We talk about downtimes. We also talk about upgrades. So there's important upgrades to our software and our programs that we take periodically that allows us to keep up with the most current version of Epic. I believe there'll be an upgrade at some point this year.
Yeah, we'll be doing 2 upgrades this
Okay.
year. The first one is May 18th.
Okay.
It's a 2-version upgrade. Epic releases upgrades quarterly,
Okay.
so we're doing them every 6 months, and we'll be taking 2 versions at a time. So it's really a kind of a paradigm shift from
Right.
our approach on our legacy systems.
But it's good to stay current with those because now you're not leapfrogging multiple things at a time. It's more just, the normal routine business that we do.
That's right, and so much of Epic's functionality builds upon previous releases.
Good.
So by staying up to date, it enables us to always ensure that we're utilizing the most modern, up-to-date Epic functionality.
And we'll do that as a system.
Yes.
And we have providers who may work on all the campuses. They move up and down at times, and so the experience on one campus will be identical to the one on the
That's
other.
correct. Yeah.
And then lastly, as the Albany Med Health System evolves, we have our 4 hospitals, obviously, and then we have the Visiting Nurses Association. They're not on Epic now. Is the plan eventually to get them on Epic?
Yes. Yep. We're initiating that work now for the VNA, and we anticipate that they'll be coming up on Epic in 2026.
Very good, very good. And that'll be great because a lot of our patients leave the hospital, go to their homes, and we want the nurses who are caring for them in that setting to have access to the same medical records, and that would be great.
Yeah, and I think that's one of the most impactful things of this
Right.
transition is it's a shared medical record so that
Right.
our clinical users are able to see the clinical information on their patients regardless of the care setting.
You and I both love numbers and data. 2 things I heard recently. First of all, activations of MyChart. We have over 150,000,
Yes.
which is remarkable. If you've not downloaded MyChart, go to your phone, go to the App Store, download MyChart. It'll allow you to see your results real time. In many cases, you can schedule appointments, talk to your provider. There's proxy accesses for children or elderly parents. It's a wonderful tool. The other number I heard was over 3 million. So that's the number of times since we've put Epic in that medical information has been pulled from another medical record with Epic at another hospital into ours, or requests, say from Boston, to pull information out of our record.
Yes.
Over 3 million times just since we went live with Epic. And it's happening probably thousands of times a day.
Yes.
And that's fantastic,
Yeah.
that sharing of medical information.
And I've had plenty of anecdotes from clinicians about the utility of that.
Well, we know when we
sharing.
take transfers
Yeah.
now, there is opportunity for the trauma doctors, for the vascular surgeons, for the cardiac surgeons to be reviewing the information on the patient, looking at the images, making operative plans even before the patient gets here. Like, that's remarkable.
Yeah.
That's remarkable.
Huge step forward.
Very good. Let's talk about a couple other things. Many people have stopped me in the hallway. They email me. They say, they've asked me at town halls. They say, Dennis, there's been a lot of executive orders that have come out from the Trump White House. Is there anything that we are doing about that? And Vic, we've put out messengers on this. I've talked about this, but maybe people have not heard that. We do have a task force. It's a task force with a few dozen individuals. It's co-led by Scott Heller from emergency management, John Regan from our government relations. It's multidisciplinary, clinical, non-clinical, college, hospital center. Everyone in the health system is involved, looking at all the executive orders and cataloging them, really, as far as whether or not there's any impact to our workforce or care delivery or services here. And we'll continue to monitor those because those EOs are in various stages of appeal or working their way through the courts. Right now, of the ones that we're tracking, there's no impact, meaning that we've had no change in any member of our employment status here. No one used to work here but was pulled out of any sort of work as part of an executive order. We've had no change in the care delivery of any of our services in the hospital or in our practice locations. One area that we are watching very carefully is in the college and research. We know that the National Institutes of Health, the Albany Med in the capital region, is the one who draws down the most dollars from NIH for research here. Very important research in cardiac disease, neurologic disease, infectious diseases. And that may or may not be impacted going forward. So I know Dr. Boulos and the PhD scientist, Dr. Sidhu, and others are looking at that very carefully, and we'll keep an eye on that as well. But just want to let you know that we are looking at those EOs. Did you get a chance to see the video that we did with Lester Clark, gentleman inside Albany Med?
I have not.
Yeah,
No.
take a look at it. We put those out on a monthly basis here. We love the fact that we get a chance to interview members of our workforce here. We call those Inside Albany Med. I think by now I've done a couple dozen of them. They're wonderful because we talk to people from all different jobs here at Albany Med. You know, we have 920 different types of jobs here. And Lester works as a gentleman in our environmental services team. He has worked here over 20 years, told a wonderful story about why he came to Albany Med, talked about why he stays here. And that's what I love about the videos, is they explain that to us. So I mentioned that in case you haven't seen it, check it out. It's on the internet. But also, if you work with somebody and you think their story is interesting, if you'd like us to tell it, as to why they are here at Albany Med, why they stay at Albany Med, why they're part of our mission, you could reach out to Jill Spadaro in our marketing and communications department. I'll let them know, and we'll be happy to put them in the list of people to interview. And in addition to that, our iCare. We're always looking for nominees for our iCare award, and there's a way in which you could nominate those individuals on the intranet. Speaking of which, we finished our town halls. I know you came, and I appreciate you being there. We did 7 of them. And we finished those up. We did them on the main campus. We've done them at 1275 Broadway, South Clinical Campus. We even did one on the weekend, and we videotaped. So if you did not get a chance to go, check it out. We'll post that. We spoke about everything we did in 24, or a lot of what we did in 24, not everything, but a lot, and the things we hope to accomplish in 25. And I think it was very well received, and I was very proud of the work that the workforce did. And obviously, it's great to share the things we hope to do in 25. So check that out. And you have an opportunity to vote, Vic. I hope you do. I hope you do. Times Union Best Of. We're nominated in 2 categories this year. One is Best Hospital, and the other is Best Urgent Care. And in this case, the one that's been nominated this year is the Malta Med up in Malta. The way the rules work are you're allowed to vote every day. Every day you're allowed to vote, and so we certainly encourage you, if you feel inclined, to please do so. And there's, I think, 4 more days. It is open until March 7th, so we have a few more days. If you haven't voted, we encourage you to do so, and hopefully we'll come back with some results later this year. Very good. All right, a lot to cover. Anything else you want to talk about, Vic?
No, I think we've covered
the
issues I'd like to discuss.
Yeah, very good. Well, we appreciate you being here. We appreciate all the work your team is doing. We know you're busy up and down, visiting the other campuses as well, but it's remarkable what we're doing, what you're doing, and I think it's laying the groundwork for really some incredible success in the future, so thank you.
Great, thanks.
And we're into March. Hopefully warm weather awaits us. May not be good for you because you like to ride your bike in the snow, but maybe I think you also like to ride
I like
it.
to ride in the dirt as well.
There you go. Yeah. All right, we'll be back again in a few weeks. We ask that you once again please take care of yourself and take care of each other, and we'll see you in a few weeks.